Hi, my name is Dr. Winnie Nyanya, a public health specialist specializing in HIV care. I've partnered with Ponea Health today to talk about HIV awareness. Other ways of avoiding HIV infection is for those populations that are at high risk. Normally, they are supported to ensure they have safer practices. If it's an injection drug user, they are helped to avoid using drugs, but we also need to ensure that they don't share needles. And they also, if it is a population of men who have sex with men, we also have services that help ensure that they reduce the chances of transmission. And the most important one is taking treatment. All those who are HIV infected need to take HIV treatment, which is antiretroviral treatment that reduces the viral load in the blood. And when the virus is reduced in the blood, this reduces the chance of transmission of the virus, whether it is to an unborn baby or to a sexual partner. So ARVs have been proven treatment has been proven to be prevention, because when one who is HIV infected is on treatment, then we reduce the chances of transmission of the virus because the viral load is significantly reduced while they're on treatment. HIV can be transmitted through different bodily fluids. We have the main bodily fluid that HIV can be transmitted, which is mostly at high risk, is blood. During blood transfusion, if one is transfused with blood from an HIV-infected person, they could get infected. Or maybe an organ transplant, that also is a high risk for HIV transmission. We have other bodily fluids like breast milk, saliva, sweat, that people wonder if this can also be part of what can help in transmitting HIV. What I can say is that HIV can be transmitted in breast milk. However, it cannot be transmitted through saliva or kissing, and this is from a low-risk population. We cannot get HIV by sharing utensils or even furniture, or even from a mosquito bite, because those are some of the assumptions and myths that population have, thinking that HIV can be transmitted through such bodily fluids. But it is just a myth, and saliva may not transmit HIV. When someone suspects that they have contracted HIV, they should take the following steps. They should, first of all, get to know their HIV status by visiting a health facility or a lab which is accredited to get their HIV status confirmed. They will get an HIV test, and part of the HIV test includes counseling. There will be pre-test counseling, then the test will be provided, and there will be post-test counseling. With the testing, the results are provided within the same sitting. And if they test HIV negative, then they will be supported to remain negative. If they're HIV positive, they'll be linked to an institution that provides treatment for people living with HIV, and they'll also be provided with other support services so that they can be able to live positively and be able to take their treatment well to achieve good treatment outcomes in their lives. When one is diagnosed to be HIV positive, this is a life-changing diagnosis, and there are some necessary steps that need to be taken for someone to be able to receive their treatment and continue living their life as normal as possible. The first step is to enroll in care. To receive, the healthcare provider will link them to a health facility where they'll be enrolled in HIV care, where they'll receive their treatment, their antiretroviral treatment, and they'll be expected to adhere to this treatment, adhere to the clinic appointments, and follow the advice of the health provider when it comes to receiving their treatment. So those are very necessary steps. The other steps are to support them to be able to take their treatment by giving treatment supporter who will work with them through the whole process of their treatment and just be able to support them. Other things will be counseling and support, because I know HIV is associated with a lot of stigma. So just counseling and support so that someone living with HIV is able to adhere to their treatment and live positively without the negative effects of stigma. and for them to be able to have healthy relationships. They are also advised to disclose their HIV status to a trusted partner who will be able to support them receive their treatment. And whenever they are not able to go for treatment, their treatment supporter will be able to support them. Thank you for joining me in this discussion. You can book my services at ponea.com. I look forward to engaging with you more in the next episode. Thank you.